Okay, good afternoon, everybody. We shall go ahead and start now. So today is Saturday, February the 6th, and let's go ahead and start with a few reminders and things to look out for as far as this upcoming week is concerned. First and foremost, you do have your lab exam later today. The timings are from 8 to 9:30 p.m. That exam has been posted. So hopefully you should be able to get to the Connect website. Just make sure that you have a reliable internet connection and that you're able to take it without any distractions. On top of that, I've also sent out the instructions for your lab activities to be turned in next Saturday. That has to do with your lymphatic and immune systems, chapters 21 and 22. So all those instructions are there, as well as grading what you are turning in for this Saturday. So hopefully by tomorrow, I should be able to update all of your grades as far as your lab exam number 1, which is tonight, and then your lab work turn in is. So feel free to check sometime tomorrow for all of those grades. Also make sure you are checking your emails diligently and that you're indeed receiving all of the communication that I send out, okay? All right. And also, as I'd mentioned in some of the prior emails, even though lab manuals and the lecture textbooks are great resources to refer to for preparation, but in addition, there's nothing stopping you from using all the resources that are at hand. Personally, myself, I am Google searching all the time. So there's no rule in the book that tells you not to do that. So please feel free to search up images for histology as an example, okay? So, and in fact, that is recommended on top of what you see in your lab manuals. If you do a Google search, go to images and look at different pictures and then go to those websites and read up on that stuff. That will definitely help enrich your understanding of the topic as a whole. And it's very understandable when we are talking about things like the cardiovascular system, the heart, and the vasculature. It could be extensive. It could feel overwhelming, even though you have to just stick to the basics and break it down into steps. There were a couple of videos, short animations that I sent out from YouTube. Continue doing that. Just go on YouTube and search different topics, immune system as an example, animations, other lectures that you might find helpful. If I come across something which is worthwhile, I'll definitely send it your way as well. So what I'm saying is use the internet to the best of your advantage. So don't get stuck on just the textbook or the lab manual, okay? Do a wide search, and we have this advantage now. When I was studying for medical school and, you know, at that time, we did not have this many resources. In fact, we were still on those, well, we did have CDs. They were still in use at that time. So I would literally go buy CDs for practicing my USMLE exam. Now those things are obsolete. You have everything at your fingertips, literally. So, so make use of that, all right? On your phones, laptops, touchpads, whatever you have, please go ahead and search those terms and try to find as much information as you can. All right, so with all those reminders and tips, I will go and feel free to share ideas with each other, right? Just like a class forum. So if you find some technique that was useful for you, feel free to share it with your classmates and they'll do the same. And that's how learning is taken to the next level when you're actually peer tutoring each other and then swapping ideas and all those things. Okay, so here we are. We are on slide number 122 on chapter 20. So let's go ahead and take a look at some of the things here. Just quickly checking the peer recording. All right. So let's start with the arterial supply to the human body, and which of course starts with the aorta, which is the main artery supplying your systemic circulation, all of your systems. That's why it's called systemic circulation, okay? And so the aorta, which emerges from where? From your left ventricle, okay? Remember that, left ventricle is connected to the aorta, and it is the gatekeeper to the aorta is the aortic semilunar valve, okay? So going back to our discussion of the heart itself. Now, once the aorta emerges from the left ventricle, it makes an arch, as you shall see in pictures, and which is called the aortic arch, not surprisingly. And the aortic arch gives rise to three main arteries from there. So on the very left, the first artery from the left-hand side is the brachiocephalic trunk, as you can see. And look at the term, brachiocephalic. Brachium means your upper limb. Cephalic means your head and neck. So brachiocephalic trunk, just based on the name itself, will supply your upper arm and your head and neck region. So it's pretty simple. Let's keep it as basic as possible. Then your brachiocephalic trunk, whenever you use the word trunk, that indicates that it's going to split up into further branches. So what are the further branches that the brachiocephalic trunk breaks into, down into? Right common carotid and right subclavian arteries, okay? Again, look at the name, right common carotid. Carotid supplies the head and neck region, okay? So it's climbing upwards to supply your head and neck region, both the external skull regions and also the internal branches to the brain itself. And then the right subclavian, clavian from the clavicle, your collarbone here. Sub means below. So the subclavian arteries, again, supply the area below your clavicles, your collarbones, okay? And so that would be your upper arm region again. So brachiocephalic trunk divides into a right common carotid and the right subclavian arteries, as you can see here, okay? Then the second branch from the aortic arch is the left common carotid artery. This one is in the middle, okay? Brachiocephalic trunk is on the very left. Left common carotid artery is in the middle. And since it's the left-sided artery, it supplies the left side of the head and neck. The left subclavian artery is the last branch of the aortic arch on the extreme right. And this left subclavian artery supplies the left upper limb and your thoracic region, all right, on the left side. So that is a simple arrangement of the aortic supply. So then the aorta, after giving off these three branches, it curves downwards, and it's called the descending thoracic aorta because it's descending, it's going downwards, all right? And on its way down, it sends out branches to different organs and body areas in your thorax and also down in your abdomen, okay? So then moving down, it passes through the diaphragm. Now remember, a diaphragm is your dome-shaped muscle, which is found right over here, and it separates your chest or thorax from your abdomen, okay? So there's a hole, literally a hole in your diaphragm through which the aorta patches. The aorta passes down into your abdomen, okay? And so that is called the aortic opening or the aortic hiatus. Those are some of the terms that apply there. And then moving all the way down through your abdomen at the level of your fourth lumbar vertebra, okay? So your lower back at the fourth L4 level is where the abdominal aorta splits into two branches, a left and a right common iliac arteries. All right, so the left and right, obviously, they supply their corresponding sides. And then each of these common iliac arteries further split down into an internal iliac, both on the left and right sides again, and an external iliac artery. And these internal and external iliac arteries supply your lower limbs, your legs, both on the right and the left-hand side. So here's your aortic arch. You can see the aortic arch. It rises from the left ventricle, making this arch here. So on the extreme left is your brachiocephalic trunk here. The brachiocephalic trunk is breaking down, bifurcating into your right subclavian artery and the right common carotid. There's the right subclavian and here's the right common carotid artery. Then the second branch of the aortic arch is your left common carotid artery here. And then on the extreme right is your left subclavian artery, okay? And then after making this arch, now here is your descending thoracic aorta. At this level, it passes through the diaphragm right over here. So now it's called the descending abdominal aorta. And then at the level of the fourth lumbar vertebra, at the L4 level, it bifurcates into a right and left common iliac artery. And then each of those iliac arteries further break down into the internal iliac on both sides and the external iliac arteries, which continue downwards into your lower leg. Now they're going to become the femoral arteries. And we'll talk about that later on, okay? So femoral arteries, which go down into the lower legs. All right, so how about the veins? Now the good thing here is the veins basically correspond to the arteries. For every artery, there's a corresponding vein. Only the veins are going in opposite direction. They are taking the blood back to the heart, right? And so that is one thing to remember. Most of the time, these veins have corresponding names as to the names of the arteries themselves. Um, Most of the time. Sometimes there are exceptions, and we'll talk about those too. So let's take a look. All right. All right. Uh, So starting with your main veins of the body, the superior and the inferior vena cava, those are the two major ones, all right? The superior vena cava, look at the term superior. It collects blood from your head and neck region, all of the body regions above your diaphragm, basically, okay? Above the diaphragm. Uh, so all the organs and the body regions, the thoracic wall, your head, neck, shoulders, upper limbs, they drain the blood into the superior vena cava, and that basically moves down into your right atrium. The inferior vena cava drains all of the organs and the viscera from below the diaphragm. So that's one thing to remember, all right? Superior versus inferior vena cava, as you can see here. Uh, Coronary sinus is a vein that collects deoxygenated blood from the heart itself and then pours it back down into your right atrium. So all three of these, superior vena cava, the inferior vena cava, and the coronary sinus, they all drain or open up into your right atrium, okay? All right, so here in this picture, you can see the superior vena cava, or rather here, superior vena cava, and then the inferior vena cava. You can see that the superior vena cava is getting blood from above. Here's the diaphragm. So it's collecting blood from above the diaphragm, while the inferior vena cava is carrying all the deoxygenated blood from below the diaphragm, from all of your abdominal viscera back to the right atrium here, okay? So what are the three main branches off of the aortic arch? The brachiocephalic trunk, which further splits into the right common carotid and the right subclavian artery. The second one is your left common carotid artery, and then the third one is your left subclavian artery. What areas in general do these branches serve? Your head and neck region, as well as your upper limbs. Which body regions are drained by the superior vena cava? All the organs and body parts above the diaphragm. Inferior vena cava, everything below the diaphragm. Okay, so let's start from the head and neck region, right all the way up to the top. So the common carotid arteries, they uh, are the ones that are supplying your head and neck region, as you can see here, okay? And then these carotid arteries, they travel parallel to your trachea, to your windpipe, and that's why when you check your pulse in your carotid arteries, you do it right next to your trachea, right over here. So you take three fingers, you curve them slightly and hold them firmly against your windpipe, against your trachea here. And you should be able to feel the carotid pulse on both sides, okay? So the common carotid artery, they divide into an external and an internal carotid artery, as you can see here. The external carotid artery supplies the skin and the musculature external to the skull. The internal carotid artery supplies the internal skull structures, including the brain itself, okay? And then there are some additional blood coming from branches of the subclavian artery, okay, both on the right and the left side, such as the vertebral artery, which sends branches to the brain, the thyrocervical trunk. Again, look at the name, thyrocervical. It's the neck region. You know it right away, right? The thyroid gland is right here, and cervix means the neck itself. And the costocervical trunk, costo is for what? Costo is for your ribs. So that's the rib region. Cervical again is neck. So costocervical trunk, the ribs and the neck region here. So what are some of the branches of the external carotid artery? Now remember, the external carotid in general supplies the areas external to the skull, right? So here, these are the branches. The superior thyroid artery goes to the thyroid gland, not surprisingly, therefore the name. So just look at the name and it'll tell you what organs, what areas are supplied by it. So let's keep it simple. The ascending pharyngeal artery to the pharynx, and pharynx is the throat region. Lingual artery, lingual is for the tongue. Lingual means tongue, so to the tongue. Facial artery to the face. Occipital artery to the back of the head region, that's the occiput, right? A posterior auricular artery behind the ears, posterior, back auricular behind the ears.
maxillary artery to the maxillary region, which is the region uh, of the upper jaw right over here. This is your maxillary region, okay? And the superficial temporal artery to the temples. So these are the branches of the external carotid. So how about the internal carotid? Now this one is going to go to the brain. This is supplying the deeper structures of the skull. So the internal carotid breaks down into the anterior and middle cerebral arteries. Cerebral means to the brain, and so it's these two branches supply the brain here. And then an ophthalmic artery. Ophthalmic means the eyes, so they supply the eye region here. All right. So these are the three branches from the internal carotid artery here. Okay. So then your subclavian arteries, both on the right and the left-hand side, they break down into the vertebral arteries, and they supply the vertebral region, your backbone, basically. That's why they're called that, right? So they even go up to the skull through the hole at the base of your skull called the foramen magnum. And there they form the basilar artery. The basilar artery divides it to give rise to the posterior cerebral arteries. Okay, so those are the three cerebral arteries. The anterior and the middle, as you can see here, come from the internal carotid artery, while the posterior one comes from the basilar artery. Okay, so what you can tell right away is the brain is one of the best supplied areas in terms of blood supply, of course, of the entire region, right? And for the same reason, what you have at the base of the brain, right about here, is something called the circle of Willis. Okay, so what is the circle of Willis? It is an arterial anastomosis, which means it's a network, an arcade of many arteries joining together. Okay, and this forms at the base of the brain. So what are some of the blood vessels that form the so-called circle of Willis? The posterior cerebral, again from your vertebral arteries, the posterior communicating, the internal carotid, the anterior cerebral, and then the anterior communicating artery. These are the main arteries that contribute to the formation of the circle of Willis. Okay, and why do you need this many arteries just lying there communicating with each other at the base of the brain? Because if one of those vessels become blocked, then you always have a detouring blood vessel that will supply your brain. All right, so your body is designed to keep your brain well supplied with blood under all circumstances, even if one of the vessels become blocked because of a blood clot or atherosclerosis, a fatty plaque forming there, or an embolism, whatever the reason for that blockage, there's always an alternate route available there. So here in this picture, you can see all of your arteries of the head and neck region, right? So the common carotid artery, uh, right? And then its branches, the internal and the external carotid arteries. You can see the external carotid artery sends further branches external to the skull, and then the internal carotid artery sends branches to the brain itself, all right? So here are the branches of your external carotid artery, right? So maxillary artery, posterior auricular, occipital, facial, lingual, ascending pharyngeal, superior thyroid artery, and they supply the regions which are found within the names themselves. So that'll help you visualize what areas are being supplied by these arteries here, okay? All right, you can also see the brachiocephalic trunk and the subclavian artery here in this picture. These two arise from your aortic arch, again, as we mentioned before. So these are the paired arteries to the head and neck, the thyrocervical trunk, the costocervical trunk, and then the vertebral artery, the common carotid artery can be seen again here. And here's your circle of Willis, right? This is the brain. You're looking at the brain from an inferior view, and you can see this is the circle of Willis, a number of different arteries which basically all communicate with each other, something called anastomosis. And they are basically protecting the brain against any ischemic damage, any damage because of a lack of blood supply. Uh, so there are many detouring blood vessels here. All right. How about the veins? So again, veins basically correspond to the arteries as we mentioned earlier. So what are the three primary veins of the head and neck region? The external jugular, the internal jugular, and the vertebral vein. The vertebral vein, again, drains your vertebral region and it empties out into your subclavian vein. The external jugular vein drains deoxygenated blood from your superficial head and neck region, okay? And then this one again empties into the subclavian vein. The internal jugular vein, on the other hand, drains blood from the cranial cavity, from around the brain, and then it joins up with the subclavian vein to form the brachiocephalic vein. Okay, and then the brachiocephalic vein will drain into your superior vena cava, uh, finally exiting into your right atrium, bringing back all the deoxygenated blood back to the right atrium. So here you can look at those veins. All right, these are the major veins draining the head and neck region: the internal jugular, the external jugular, and then the vertebral vein. And so, and then they further drain down into the subclavian vein, the right subclavian vein, and then the right brachiocephalic vein is right here. And here, these are the veins. Look at the names. They again correspond to the arteries. The occipital vein drains the occipital region, superior temporal vein drains the temporal region, the maxillary vein, the maxillary region, so on and so forth. So all of them are draining the same regions. All right. Uh, so as far as what blood vessels you have to focus on, you don't have to memorize all of them because there's a whole lot of them. Uh, I will be sending out a study guide which will basically single out the ones that are important that you should focus a little bit more on. All right, so do not worry about memorizing each and every one of those. Okay, so how about the brain itself, the cranial cavity? Okay, so the cranial cavity is drained by these veins around the brain called sinuses or dural venous sinuses, as you can see here. So these are veins that basically drain out the deoxygenated blood from the brain itself, all right? And they drain primarily into your internal jugular veins. So here you can see the dural veins, all right? These are the veins that drain your brain, the venous sinuses. And look at the names. Again, if you look at the name, they will give you a pretty good idea of where these blood vessels are located at, all right? So for example, uh, superior sagittal sinus. So in the sagittal region, and we did that during ANP1. This is the sagittal plane right here, right? So the superior sagittal sinus is located very much in the same region. The occipital sinus right at the back of the head, back of the brain, okay? Uh, transverse sinus, as you can see, runs transversely across. Sigmoid sinus it's curvy, it's S-shaped, therefore sigmoid sinus. Um, inferior sagittal sinus, it's just inferior or below the superior sagittal sinus. You can see those here as well. All right, so let's move down into your chest and abdominal region, thoracic and abdominal walls, as you can see. All right, so there's different branches here, okay? And again, just as long as you can look at the names and kind of narrow down the body region which is being supplied by those arteries based on the name, you're good. Okay, you don't have to be extremely specific about each. For example, the internal thoracic artery again supplies the thoracic region, including the mammary gland, the breast region again. It emerges from the subclavian artery, okay, and then again, subclavian artery emerges from your aortic arch, as we mentioned before, and the branches of the internal thoracic artery include the anterior intercostal arteries, which supply the intercostal spaces in between your ribs, and then also musculophrenic artery. Phrenic means your diaphragm. So this is a branch which is supplying your diaphragm muscle, right? And then after sending off these branches, the internal thoracic artery becomes the superior epigastric artery now. All right, and the superior epigastric artery, what is that region? The epigastric region, right over here, right? Right in front of your stomach, this region here. So the superior epigastric artery supplies the superior abdominal wall. And then uh, you have another artery with a somewhat similar name, but this one is called an inferior epigastric artery. And this one supplies the correspondingly the inferior abdominal wall. And this one is actually a branch of your external iliac artery. External iliac artery, okay? And so both the superior and the inferior epigastric arteries meet with each other. It's called an anastomosis when two arteries meet, okay? Further down, now the aorta turns into the lumbar arteries and they supply your lumbar region, okay? 5 pairs to be specific. They supply your lumbar region. What is your lumbar region? Your lower back. And then eventually the median sacral artery, it supplies the very end of your back, okay? So here you can see There's your aortic arch and the branches, the brachiocephalic trunk, the left common carotid, and the left subclavian artery. Then it makes the arch and turns into the descending thoracic aorta, which gives of these branches to your costal region, to your rib region, right? The intercostal arteries, that you can see those. And then it passes through the diaphragm, where it gives of the musculophrenic artery. Phrenic again supplies the diaphragm, as the name indicates. And at this point, now it is called the descending abdominal aorta, because it has reached the abdominal region. It is also um, given rise to the superior epigastric artery here. Okay. Then it goes down. It also sends off branches to the kidneys. These are called the renal arteries, the right and left renal arteries. And then these are the lumbar branches from the uh, descending abdominal aorta. They supply the lumbar region, and then the median sacral artery right here, that is supplying the sacral region. So at the region of the L4, the descending abdominal aorta splits into the left and right common iliac arteries. The left and right common iliac arteries are further divided into the external iliac and the internal iliac arteries on both sides. You can see those. And then, of course, the external iliac artery also gives rise to the inferior epigastric artery. The inferior epigastric artery is meeting up and joining with the superior epigastric artery here. Okay. So again, and this is called an anastomosis, joining together of arteries uh, to have a broad coverage of blood supply to different organs. Okay, so how about the veins? Very similar names. That's the good news. The names correspond with the arterial supply, right? So the internal thoracic vein, which receives blood from the anterior intercostal veins, again, the thoracic region, also from the musculophrenic and the superior epigastric veins, and then the internal thoracic vein drains into the brachiocephalic vein. Then you have the inferior epigastric vein, uh, that merges with the external iliac vein. All right. So again, the very same arrangement, only they're going in the opposite direction now. Arteries are moving away from the heart, supplying oxygenated blood to the different parts of the abdomen and the thorax. The veins are going back towards the heart with similar names. All right. And so these are two main veins uh, on the two sides of the body. The hemiazygos and the accessory hemiazygos veins, they drain the left side of the body, while the azygos vein drains the right side of the body. Okay. And they drain into the superior vena cava, the superior vena cava, which again is gonna lead to your right atrium of the heart. So here, you can basically just uh, follow along all the veins, similar names, the internal and the external iliac veins. They join together to form the left and right common iliac veins, which come together to form the inferior vena cava. Here are the what? The lumbar veins, which are draining again here into the inferior vena cava. Here are the renal veins, again draining back into the inferior vena cava. The inferior vena cava ascends into the thorax here. And then what happens here is you have the accessory hemiazygos and the azygos veins on the left side of the body, and you have the azygos vein on the right side of the body. They all drain into the inferior vena cava, as you can see here. And then the inferior vena cava is eventually going to be draining back into the right atrium of the heart. So here, this diagram shows you a, uh, a broad overview of the venous drainage of the region. Okay, so how about some of the other thoracic organs that are being supplied by these arteries? So the lungs are supplied by the bronchial arteries and the bronchial veins, okay? And both of these are branches of your thoracic aorta, as you can see, okay? I'm sorry, the bronchial arteries, of course, are the branches of the descending thoracic aorta. The veins, they drain back into the azygos and the pulmonary veins, all right? The esophagus, same thing, esophageal arteries, which are branches of the descending thoracic aorta, uh, and then the esophageal veins, which drain into the azygos or the left gastric vein. Okay, so how about the blood supply to the diaphragm? So a number of arteries and veins supply the diaphragm region. Why is the diaphragm important? Because this structure separates your thorax, your chest, from the abdomen, okay? Um, so what are some of those branches? The superior phrenic artery, which are branches of the descending thoracic aorta, then the inferior phrenic arteries, which emerge from the descending abdominal aorta, both of them are from the aorta, as you can see, and then the musculophrenic and the pericardiophenic arteries, and they arise from the internal thoracic artery. Okay. How about the veins? Similar names: superior and inferior phrenic veins, which drain into the inferior vena cava, and then a musculophrenic vein. So here, this is your diaphragm region, right? And so you can look at the branches going to the diaphragm, the superior phrenic arteries, as you can see, and then the inferior phrenic artery. All right. And both of them are branches of the aorta itself. All right. So how about your digestive organs now? Moving down from the thorax into the abdomen and into the digestive system. Okay. So there are three unpaired arteries which serve your GI tract, your digestive organs. The celiac trunk. Celiac means the stomach region. So that gives you an idea. All right. What is being supplied here? And then a superior and the inferior mesenteric artery. So the celiac trunk itself, which comes from the abdominal aorta, has three further branches: the left gastric artery, which supplies the left side of the stomach and the esophagus; the splenic artery to the spleen, and therefore the name; and then the common hepatic artery to your liver. Hepatic means the liver again. And then the common hepatic artery further breaks down into the hepatic artery proper and the gastroduodenal artery, which supply the stomach and your small intestine, the duodenal region, as you can see. So here's your celiac trunk from the abdominal aorta, and these are the three branches of the celiac trunk: the left gastric artery, the splenic, and the common hepatic. And it mentions what uh, digestive organs are being supplied by each of these. Okay, so right below the celiac trunk, you have the superior mesenteric artery, okay? And this one has these branches here: the intestinal arteries to the intestinal region, the small intestinal region; the middle colic artery to the colon, which is your large intestine; the right colic artery to the ascending colon, again, your large intestine; and then the ileocolic artery, which supplies, again, your large intestine and part of your small intestine as well. Ileum is a part of your small intestine. And then finally, the inferior mesenteric artery, which has these three branches: the left colic artery supplying the left side or the transverse colon and the descending colon, okay? Sigmoid arteries, which supply your sigmoid colon, again, which is part of your large intestine, and then the superior rectal artery to the rectum. Here in this picture, here's your superior mesenteric artery, and these are the four branches: the middle colic, the intestinal, the right colic, and the ileocolic artery. They all arise out of the superior mesenteric artery. Here is your inferior mesenteric artery with the three branches: the left colic artery, the sigmoid, and then the superior rectal. And the regions supplied by each are mentioned here as well. Okay, so here we are looking at the venous drainage from the uh, digestive organs, okay? And principally here you're looking at the liver. So the venous return from the liver is part of the hepatic portal system, okay? And this is important. The hepatic portal system, the hepatic portal vein, is extremely important because this vein takes all of your digested food from your digestive organs and takes that food to your liver for further detoxification and processing. Okay, so everything you eat will be further processed in your liver to make sure that there are no toxins, no bacteria, and no spoiled food which is being supplied to your body, right? So the liver is the detox and the processing plant. After the liver approves and certifies that this food is safe for intake, only then this goes to your hepatic veins, then through the hepatic veins into your inferior vena cava, then to your heart, and then your heart pumps out this nutrient-rich blood to the rest of the body. So the hepatic portal vein is extremely important. Uh, the hepatic portal vein itself is made up of these three veins: splenic vein, draining the spleen; inferior mesenteric vein, again, draining the the large intestine; and the superior mesenteric vein that drains the small intestine, okay? So the hepatic portal vein flows through the liver sinusoids. Remember, sinusoids are little capillaries, and then the blood leaves the liver by means of hepatic veins. And these hepatic veins contain all the nutrients that have been processed and approved by the liver for the supply to the rest of the body, and then they drain into your inferior vena cava, which will take it back to the right atrium. So here you can look at your hepatic portal vein, okay? This is your hepatic portal vein formed by the superior mesenteric vein, the inferior mesenteric, and the splenic vein. These three come together to form the hepatic portal vein, which goes to your liver. The liver processes all of this food, nutrient-rich food from your intestines. After it has been processed, then it is returned by means of the hepatic veins into your inferior vena cava to be carried back to the heart and for supply to the rest of the body. Okay, what about your kidneys now? So your kidneys uh, receive this blood supply. All right, so there's a middle suprarenal artery, uh, and all of these are coming from your abdominal aorta. Again, your aorta is giving rise to these branches. A renal artery, which supplies each kidney, the right and the left renal artery, and a gonadal artery, which supplies your gonads. What are the gonads? The sex glands, ovaries in females, and testicles in males. Okay, all three branch off of the descending aorta, as you can see. All right, so then at the level of the fourth lumbar vertebra, your descending abdominal aorta splits into a right and left common iliac artery, each of which divides into an internal and an external iliac artery, okay? So let's take a look at the branches of the internal iliac artery, the superior gluteal artery, which supplies your gluteal region, which is the region of the buttocks, right? The muscles there, the gluteus medius and the gluteus maximus. So the superior and the inferior gluteal artery, the superior vesical artery, vesicle means the bladder, the urinary bladder, the middle rectal artery to the rectum, the vaginal and uterine arteries to the vagina and the uterus in females, the internal pudendal artery to the anal region, and then the obturator artery, which supplies your medial thigh muscles. All of these are branches of the internal iliac artery. Okay, here's your descending abdominal aorta. It gives off the renal branches, right and left renal artery to the kidneys. And then these are the lumbar arteries again. Then at this level, it splits into a right and left common iliac artery. Here's and then each of these common iliac arteries branch into an internal iliac and an external iliac branch, okay? And so these are the further branches of your internal iliac arteries, the superior vesical, superior gluteal, middle rectal, vaginal, all of those that we have talked about. And they supply the organs which are named uh, within the names of the arteries themselves. So easy to remember there. Okay, so what major arteries supply the head and neck region? The external and the internal carotid arteries. What primary veins drain these regions? The internal and the external jugular veins. What is the function of the dural venous sinuses? To drain deoxygenated blood from your brain. Does the azygos system, which receives venous blood from the thoracic and abdominal wall, drains into the superior vena cava or the inferior vena cava? So inferior vena cava is the one that drains all of the blood below the diaphragm, okay? What are the systemic arteries that supply oxygenated blood to the lungs? The bronchial arteries. What specific structures of the lung receive the blood? Basically, the lobes of the lung. The lung has different lobes, and they receive blood from these branches. What are the three branches off of the celiac trunk, and which organs do these vessels supply? So you had the splenic artery, you had the gastroduodenal artery, right? And you had the left gastric artery. These are the three branches from the celiac trunk. What are the three primary veins that drain into the hepatic portal vein? What were those? The splenic vein, the gastroduodenal vein, and the left gastric vein. What is the function of the hepatic portal system? To carry all of the nutrients absorbed from your intestines, from your digestive organs to the liver for further processing. What arteries supply the kidneys? The renal arteries, the left and right renal arteries. The adrenal glands, the suprarenal arteries. The female uterus, the uterine artery, of course. So easy to name them based on the organs. All right, so here is the blood supply to your limbs, okay? So first up, the subclavian artery. And again, looking at the name, this is going to supply your area below the clavicle, below the collarbone, okay? So the left subclavian artery, again, as we talked before, comes off of the aortic arch. The right subclavian artery comes off of the brachiocephalic trunk. So the subclavian artery uh, turns into the axillary artery after it passes the first rib. After it passes the first rib, now the subclavian artery is termed the axillary artery. Okay, and the axillary artery supplies the axillary region, the armpit region, the chest wall, the shoulder, and the upper limb, the humerus region. Okay, now after the axillary artery passes the muscle called the teres major muscle in your upper arm region again, now it's called the brachial artery because it's going into your brachium, which is your upper arm again. Okay. The brachial artery then further splits into a radial and the ulnar arteries. The radial artery on the radial side or the lateral side of the upper limb, and the ulnar artery on the medial or the inner edge of your upper limb. Okay. Both these radial and ulnar arteries will actually meet each other in the region of your palm and your wrist, in your wrist region. Okay. So you have two of these arches, a deep and a superficial palmar arch, where these two arteries, the radial and the ulnar branches, come together. Okay, and then from this palmar arch, digital arteries arise, which supply each of your digits, the 5 fingers. All right. Here, so in this picture, let's see. Here's the subclavian artery, right? As soon as the subclavian artery passes beyond the first rib, now it's called the axillary artery, which supplies all of these regions mentioned here. As soon as the axillary artery passes the teres major muscle in this region, now it's called the brachial artery. The brachial artery supplies your upper limb, of course, right? And then at the level of your elbow, the brachial artery splits into the radial artery laterally and the ulnar artery uh, medially here, these two arteries, right? And then at the level of your wrist, these two come together, forming a superficial and a deep palmar arch, right? This is the anastomosis, the meeting point of the radial and the ulnar arteries. And then from this palmar arch, these digital arteries arise, which supply each of your fingers right there. All right, so how about the venous drainage from this region, okay? Let's take a look at the picture again for the venous drainage. Now it's going in the opposite direction because of course you're taking blood back to the heart. So here are your digital veins from each of the 5 fingers. The digital veins drain your fingers and thumb, and they drain back here into the superficial and in the deep venous arches, venous palmar arches, and then this blood is carried by means of the radial vein on the radial side and the ulnar vein on the ulnar side, on the medial side, right? Then you have further veins called the cephalic vein on the radial side and the basilic vein on the medial side that also carry blood back. All right, and then the basilic and the cephalic veins come together to form the median cubital vein in your elbow region. Now this is important. This vein is important because this is where you perform a venipuncture. Okay, venipuncture again is when you draw blood from this region. So the median cubital vein is important because of venipuncture. This is where you will draw blood from in a person because this is one of the more visible and easily accessible veins, okay? So then what happens? So the cephalic and the basilic vein continue to rise up, and here they come together and join the axillary vein. The axillary vein turns into the subclavian vein. The subclavian vein then joins up with the brachiocephalic vein, forming the superior vena cava and then draining back into the heart here. All right, so now let's take a look at the external iliac artery. So the external iliac artery becomes the femoral artery, okay? And again, this is an important artery because femoral artery is used for palpation. When you're looking for your pulse, one of the regions where you will feel for pulse, so you can do it here in the head and neck region, right? You can do it here uh, with your carotid arteries, but you can also do it down here in your thigh region, right? So basically you take your thumb and you press it down in your groin region. This is where the femoral artery is. And so that is where you will feel a definite femoral pulse if you have good blood supply there, okay? All right, so then the femoral artery moves all the way down, and at this point, at the point that it reaches the knee, now it's called the popliteal artery. All right, anterior and posterior, both popliteal arteries here. The popliteal artery then turns into the anterior tibial artery because this is the tibia, the shin bone. So in the shin region, now it's called the anterior tibial artery. Similarly, there's going to be a posterior tibial artery supplying the back of the lower leg here as well, right? And then there's a side branch called the fibular artery because that artery corresponds with the fibula, the bone here, right? So this is the splint bone, this little bone um, on the lateral side of the lower leg. So a tibial artery and a fibular artery. So both of these arteries come together in the uh, plantar arch, right? Just like you had a palmar arch, you have a plantar arch here. These two arteries, the fibular and the tibial arteries joining together. And from the plantar arch, these digital arteries supply each of your toes. So very similar arrangement as your upper limb, only the names are different. Instead of palmar arches, you have plantar arches here because this is the lower limb now, okay? All right, how about the venous drainage from that area? Very same as we mentioned before, right? So here you have the digital veins which drain your toes. They go back to your plantar veins. All right, here's the plantar arch. Then you have a small saphenous vein, okay, and a much larger great saphenous vein, which drains your lower leg region. And then also the anterior tibial vein and then the fibular vein on both sides here. So if you remember the great saphenous vein here, this is extremely important for another reason, uh, for coronary artery bypass grafting. If you remember when we performed that procedure called CABG in people with coronary artery disease, the vein which is usually used for forming that graft in your heart is this one, the great saphenous vein. All right. So the great saphenous vein is often used and is important for used for grafting during a CABG procedure, coronary artery bypass grafting, for grafting during CABG, coronary artery bypass grafting. All right, so all the way up here, then the popliteal veins, anterior and posterior, they join together to form the deep femoral vein. Then the femoral vein, and the femoral vein will again go up to form the external iliac vein, and then the common iliac vein, which will join the inferior vena cava all the way back up. What is the sequence of vessels from the subclavian artery to the digital artery of the thumb? So from the subclavian artery to the axillary artery to the femoral artery, I'm sorry, axillary artery to the brachial artery, then the radial and ulnar arteries, then the superficial and the deep palmar arches, and then the digital arteries uh, to the thumb and the fingers. What are the primary superficial veins of the upper limb? Uh, the cephalic and the basilic vein and the median cubital vein. Can you trace one pathway that blood may be transported through from the external iliac artery to the digital arteries? Surely. From the external iliac artery to the femoral artery, from the femoral artery in the thigh to the popliteal artery, anterior and posterior in your knee, then the anterior and posterior tibial arteries in your lower leg region, and a lateral fibular artery, which form the plantar branch or the plantar arch in your ankle region, and then the digital artery supplying your toes. How do the great saphenous and the small saphenous vein compare in terms of their anatomic position and length? The great saphenous is much greater, bigger, larger. Small saphenous is smaller. Okay, so what we are looking at here finally is the fetal circulation. When you were a fetus, an unborn child, what were some of the extra blood vessels that were there that you don't have in an adult or in a newborn child for that matter, all right? So first up, you had a placenta, of course, when you were a fetus, and the placenta gave rise to the umbilical cord. The umbilical cord here, as you can see, had two umbilical arteries and a single umbilical vein, okay? So these two umbilical arteries were actually carrying deoxygenated blood from the fetus back to the mother's circulation, okay? And the single umbilical vein was bringing in fresh oxygenated blood from the mother's bloodstream to the fetal bloodstream. So here there's a reversal of what veins and arteries do. Usually arteries carry oxygenated blood, but not so in the umbilical arteries. They carry deoxygenated blood from the fetus back to the mother for oxygenation, okay? All right, so So what happens here is that uh, the umbilical vein attaches directly to the inferior vena cava of the fetus by means of a structure called the ductus venosus. The ductus venosus directly connects the umbilical vein from the mother's umbilical cord to the inferior vena cava of the fetus. Because again, this is fresh oxygenated blood. No further oxygenation needs to be done. So this goes directly to your right atrium, and the heart of the fetus can pump it out directly to the rest of the body. Also, notice how there's an open foramen ovale, right? So the right side of the blood can easily mix with the left side because, again, in the fetus, there's no need for lungs to work for oxygenation. The fetus is not even breathing technically, right? The lungs are deflated. It's getting all of its oxygen and nutrients from the mother's blood supply. So the blood can pass easily from the left to the right side of the heart here and be pumped out to the rest of the body, okay? So one additional structure that you have here is something called the ductus arteriosus in the fetus, ductus arteriosus. The ductus arteriosus connects the pulmonary trunk directly with the aorta, okay? So there's no reason for the blood to go to your pulmonary trunk because the lungs are not even working. So that oxygenated blood from the mom in the fetal circulation directly moves from the pulmonary trunk to the aorta and then is supplied to the rest of the body. So ductus venosus and ductus arteriosus, these are two additional structures. And of course, the foramen ovale in the heart of the fetus. So remember, the ductus venosus connects the umbilical vein directly with the inferior vena cava of the fetus, while the ductus arteriosus connects the pulmonary trunk and the aorta in the fetus. So sometimes these don't close properly even after birth. So that is called a PDA for patent ductus arteriosus. And that is a problem after birth because now the child's lungs are actually working. If you have an open ductus arteriosus, that means the deoxygenated blood from the pulmonary trunk is freely mixing with the oxygenated blood of the aorta. And that's going to cause problems with oxygenation. So what are some of the signs and symptoms that you will see in this child? Respiratory distress. The child is turning literally blue, cyanosis because of lack of oxygenation. He seems to be in respiratory distress. All right. So signs and symptoms of a PDA, patent ductus arteriosus. Okay. How do you treat it? Uh, so there is a medical treatment. Sometimes certain medications like something called indomethacin, okay? Indomethacin, which is a non-steroidal anti-inflammatory drug, pretty much like aspirin. Indomethacin can be used to treat, to close this open, used to treat a patent or open ductus arteriosus, okay? Uh, but if this does not work, then you always have the option of surgery. You can surgically close the patent ductus arteriosus so the child can breathe on his or her own. So list the 5 structures of fetal circulation. Well, patent ductus arteriosus, uh, ductus venosus, 2 umbilical arteries, and a single umbilical vein. Why is it important for the ductus arteriosus and foramen ovale to both close after birth? Because you don't want a mixing of the right and left side of the arterial blood with the venous blood, right? All right, so let's move on to our next chapter for today, which is the lymphatic system. Okay, so here it is. Let's go ahead and start. So the first question is, well, what is the lymphatic system? So lymphatic system is basically a network of vessels, which are called lymphatic vessels that carry not blood, but lymph. What is lymph? Lymph is this milky white fluid within our systems that is derived from blood, but it's not red like blood because there's no hemoglobin there. So what lymph in fact carries is excess fat from from your digestive system, the fat that has been absorbed from your food, and also your immune cells, your white blood cells. All right. So your lymphatic system is an extremely important part of your immune system because it carries your immune cells. Okay, and that's what you're looking at here. What the lymphatic system does is it removes excess fluid and returns it back to the blood. Okay, it basically drains into your inferior vena cava at the base of the neck. That's where all of your lymph rejoins the blood, okay? So here in this picture, you can look at your lymphatic vessels. Look, there's a bunch of them. All of these green blood vessels, these are lymphatic blood vessels, as you can see, okay? And something else that you will notice is the lymphatic vessels are pretty much like veins. They look like veins. They even have these valves, okay? Remember, veins had valves only allowing for blood to flow back to the heart. Similarly, your lymphatic system also has these valves to ensure that lymph only flows in one direction, that is back towards the heart. Okay, so then what else you see in this picture is how your lymphatic organs are divided into a primary and secondary lymphatic structures, all right? So if you look at your primary lymphatic organs, there's two of them. The thymus, this gland here in the chest, which is only functional in prepubertal children. After puberty, the thymus basically shrivels up, it atrophies, and it's not functional, all right? And then your red bone marrow, again, functions as your primary lymphatic structures. So why are these two called your primary lymphatic structures? Because these two organs make what are called your lymphocytes. Your lymphocytes, right? Your T cells and your B cells. T cells mature here in the thymus, and the B cells come from the red bone marrow. Uh, then you have what are called the secondary lymphatic structures, and they include your tonsils, your lymph nodes, your spleen, and what is called your MALT for your mucosa-associated lymphoid tissue. Okay, so remember the primary versus the secondary lymphatic structures. Why are they called primary structures, these two? Because they give rise to the actual lymph cells, the T lymphocytes and the B lymphocytes. Why are these called the secondary lymphatic structures? Because they have secondary functions in your immune functioning and your lymphatic functioning, okay? So what is lymph, this fluid, like? As I mentioned, it's this milky white color, and it's made up of a whole lot of fats, okay? Dissolved solutes, a lot of water, some protein there as well, and it also carries pathogens, germs that might enter your system. They're trapped by your lymph, within your lymphatic system, and cancer cells. If you're cancer cells, they are also transported by the lymphatic fluid as well, okay? So your lymphatic capillaries, we just took a look at those. They look like veins, right? Tiny veins, small closed-ended vessels that absorb interstitial fluid. You have limited lymphatic capillaries in these regions, in your spleen, bone marrow, and also in your central nervous system around your brain, okay? Now, your lymphatic capillaries in your digestive system, in your GI tract, they have a special name, lacteals. Okay, so the lymphatic capillaries in your GI tract are called lacteals, and their function is to absorb fats or lipids from your digestive system as well. So you need a healthy functioning lymphatic system in order for all the fatty foods that you eat to be absorbed successfully from the GI tract. Here, this is what lymphatic capillaries look like. You can see they're dead ends, right? Closed-ended vessels. So the lymph is squeezed from the surrounding tissue into these lymphatic capillaries, and the lymph can only flow in one direction, back towards the heart. And so here are the valves. These valves are unidirectional, which means they make sure that the lymph flows only in one direction, back towards the heart. So here you can see all of these green ones. These are your lymphatic capillaries. That is an artery. This is a vein. The red one is the artery. The blue one is the vein, and these green ones are the lymphatic blood vessels, okay? So what keeps these lymphatic capillaries working? What keeps pushing the lymph back into the lymphatic capillaries? Hydrostatic pressure of the surrounding tissue, simply. And we talked about hydrostatic pressure, right? The hydrostatic pressure is the built-up pressure of the fluid around a structure, so that the hydrostatic pressure itself is moving the lymph inside of the lymphatic capillaries. So the lymphatic capillaries join together to form larger vessels called lymphatic vessels, which join together to form even larger lymphatic trunks, which join together to form the largest lymphatic ducts. Ultimately, all of this fluid goes back to your blood supply, all right? So here we're looking at your cancer cells. Now the cancer cells uh, reach different parts of your body by means of two routes, through the blood and through your lymph, all right? So these are the two major highways for transporting cancer cells from one point to another. And that's what a cancer is. Cancers metastasize, metastasis, which means these little seeds of cancer, if you will. These little cancer cells, they break off from one place and then they float throughout your body, either through your blood supply or your lymphatic blood supply, your lymphatic supply, right? Um, for example, your breast cancer may metastasize to your lungs because lungs are located right in the breast region, right? And that happens through your lymphatic capillaries as well. All right, so we also know that your lymphatic vessels have valves, and these valves prevent the lymph from falling back into your lower extremities. It keeps your lymph moving back up towards the heart. So the more you exercise, okay, the more you breathe deeply, the more lymph is returned back to your circulation, just like your venous supply. And that's why exercise and massage is good. Uh, and so that's why you see sometimes uh, people, breast cancer sufferers, right, who have had their breasts removed surgically on account of the cancer, something called radical mastectomy. They often get massively swollen uh, limbs on the side of the where the breast was removed, right? Why is that? That is something called lymphedema. And so what's happening here, lymphedema in post-operation or post-op mastectomy patients. Okay, so why do their arms swell up on the side where the breast was removed? Because when mastectomy was done, the breast and the underlying muscles were removed. It also removed all of their lymphatic capillaries and the lymph nodes. So the lymph has no place to go. It gets trapped in their arm. So the arm gets thicker and swollen and enlarged, right? So how do you get rid of this lymphedema? You can try to massage this lymph back towards the heart, right? Or you can have like compression stockings. You can put those on your arm and they like kind of deflate and inflate, and they kind of massage, milk the lymph back towards towards the heart, back to your blood circulation. Okay. So these are some of the lymphatic trunks which are fed by lymphatic vessels. The jugular trunk, again from the head and neck region, the name tells you that. The subclavian trunk from your upper limbs, the bronchomediastinal trunk from the thorax, intestinal trunks from the intestinal region, lumbar trunks from the lower back region, as you can see here. Okay. And then the lymphatic trunks feed into the largest of all, the lymphatic ducts. There's two of them, a right lymphatic duct on the right-hand side and a thoracic duct on the left-hand side, which is much larger, okay? So here in this picture, you can see which areas of the body drain into the right thoracic duct, which is in this dark green color. Okay, so that would be your right arm, part of your right chest, and the right head and neck. But all the rest of the body, as you can see here in a lighter green color, is drained by the left, by the thoracic duct, which is the largest of all. All right. So this area is drained by the thoracic duct. This one here is drained by the right lymphatic duct. So here is a picture that tells you where all of these trunks and ducts are located, right? So the right jugular trunk, the right subclavian trunk, these are all lymphatic vessels, of course, lymphatic trunks. And then the right lymphatic duct here, which is the larger one, uh, and then the thoracic duct, which is the largest of all on the left-hand side, okay? So lymphedema, we talked about what that is. That is when lymph accumulates in a part of the body, right? So we talked about one clinical situation, which is post-surgery. If you have like breast cancer, you got it removed, and then you got lymphedema here. There's other infectious causes too. Infections that can cause lymph to build up in your system, such as a parasitic infection called elephantiasis or filariasis. Now, this is endemic. This is quite common in certain South American and African countries. Now, this is a parasite, a worm that is uh, spread by the bite of a female mosquito of the Culex species. All right, so the Culex female mosquitoes spread this parasitic worm, and the parasite itself is called Wuchereria bancrofti. Right, it's a long name, Wuchereria bancrofti. This is the parasitic worm that is transmitted by the bite of the female Culex mosquito. What these worms do is they have a propensity to swim in your bloodstream and then get into your lymphatic vessels and block them. So they multiply by the thousands, and they can grow to the point where they can literally block up your lymphatic vessels. And so what happens is when you have a blockage of lymphatic vessels, all of this lymph starts accumulating in your lower legs and in your genital region, actually. So in some bizarre cases, there were males whose scrotum, the sac of skin that carries the testicles, grew to the size of a football, actually a basketball, and even larger, because all of this lymph was actually accumulating in those regions. Okay. So that's what elephantiasis, and that's why it's called elephantiasis. Your legs become so inflamed and so thick they look like elephant legs. All right. So fortunately, there are treatments for elephantiasis. For example, you can use antiparasitic medications. One such drug used for elephantiasis is something called ivermectin. Okay, uh, which is a drug used to treat used to treat elephantiasis. Okay. Uh, so what it does is it paralyzes and kills off those worms. All right, so they pass out. Uh, or sometimes even surgery is needed, surgical removal of these worms and some of the lymph nodes which are infested with those. Okay. So what substances typically are absorbed from the interstitial space into lymphatic capillaries? Lymph, okay, which is made up of some proteins, water, and fats, and of course, immune cells. How does fluid enter and become trapped in the lymphatic capillaries? The fluid enters by means of hydrostatic pressure. It becomes trapped because you have one-way valves there. What mechanisms are used to assist lymph movement through lymph vessels? Exercise, massage, breathing. It all sucks the lymph fluid back up towards the heart. Which major body regions drain lymph to the right lymphatic duct? The right arm, a part of the right chest, and the right side of the head and neck region. All right, so here are your primary versus secondary lymphatic structures. All right, so remember, what were the uh, primary lymphatic structures? Only two, the thymus and the red bone marrow, okay? And these are called primary because this is where the lymphocytes, which are an important part of your immune system, are formed and mature, actually. And then you have the secondary lymphatic structures, and they're called secondary because they do not form the lymphocytes, but they're used for in the maturation process of such. And they include the lymph nodes, spleens, tonsils, and then lymphatic nodules and mucosa-associated lymphatic tissue, as you can see. So how are primary and secondary lymphatic structures differentiated? The primary lymphatic structures actually give rise to the lymphocytes or the immune cells. The secondary lymphatic structures play a secondary part in their maturation. All right, so the red bone marrow, that's one of your primary lymphatic tissues, right? Where is it found? Mostly inside of the flat bones of your skull, ribs and sternum, also the ends of your long bones, and in your backbones, vertebrae here, okay? And the red bone marrow is important because this is where you form blood. Hemopoiesis or blood formation takes place here, which means that both your red and white blood cells actually come from your red bone marrow. So here we're going to focus on your white blood cells, specifically your T and B lymphocytes, okay? T lymphocytes, they mature in the thymus, T for thymus. B lymphocytes, they mature and are formed in your bone marrow, so B for bone marrow, okay? All right, so the thymus is this gland which is found in your chest region in the mediastinum. It's most active before puberty, right? It kind of regresses and dies out after puberty. And what it does is it basically is needed for T lymphocyte maturation. So let's take a look at what it looks like here. This is a kid, a child, a pre-pubertal individual, and you can see that the thymus is quite large and functional here. This is what happens to the thymus after puberty. It literally shrivels up. You see, it's become this small little organ here. All right. And this is what the thymus looks like under a microscope, okay? This is a thymus from a functional thymus from a child. This is a thymus from an adult. You can see much of it has just shriveled out, died out. All of this is fat tissue has accumulated here. Only some islands of still functional thymic tissue remain. So what else do you have in the thymus? You have the outer region, which is like dark purple in color, called the cortex, and you have these pinkish, lighter colored regions deeper to the cortex called the medulla. This is a capsule, a thick connective tissue capsule that surrounds the entire region, okay? So why is red bone marrow considered a primary lymphatic structure? Because it gives rise to both the T and the B lymphocytes. how are the two types of T lymphocytes arranged in the cortex and the medulla. So what happens is the cortex, the outer uh, purple region, contains immature T lymphocytes, while the medulla, which is the lighter colored pink deeper region, contains the mature T lymphocytes. Okay. All right. So then the secondary lymphatic structures, which include spleen, lymph nodes, tonsils, and MALT, you see all of them here. Um, So what is the difference between lymphatic organs and lymphatic nodules? Lymphatic organs actually have a well-defined capsule surrounding them, like the spleen and lymph nodes. They are lymphatic organs because they have a well-defined capsule surrounding them. The lymphatic nodules do not have a capsule. They're just clusters and patches of lymphatic tissue distributed throughout the organ without a capsule. Okay. All right, so what are lymph nodes? Lymph nodes are these lymphatic organs which filter your lymph. In other words, they're always on the lookout for any infectious pathogens, germs, or cancer cells which might be in your lymph. And so they trap those. They're kind of like your checkpoints of the body, right? Or the tollways. Whenever you pass through a toll, that's what the lymph nodes do. They keep an eye out for infectious particles and for cancer cells which might be circulating in your lymphatic flow. And they're found in different parts of the body, like the cervical lymph nodes in the neck region, axillary lymph nodes in the uh, axillary region, and the inguinal lymph nodes in your pelvic region. So if you have a fever, uh, right, uh, loss of weight, those kinds of things, there are two possibilities: either an infection going on, or maybe heaven forbid, a malignant, a cancerous process. So in both cases, the doctor will palpate or feel for your lymph nodes, for your enlarged lymph nodes. They usually palpate for your submental lymph nodes over here, or maxillary lymph nodes, or the cervical lymph nodes, right? If they are enlarged, that indicates that there's some kind of either an infectious process or some cancerous process going on in your head and neck region. Similarly, for your breast cancer, they will feel for these lymph nodes here, right? If they're inflamed and enlarged, then that could be a sign of it. Inguinal lymph nodes for things like STDs, sexually transmitted diseases or infections of the pelvis, that might give you enlarged lymph nodes, all right? Um, so the question is, how do you differentiate based on your lymph node clinical exam if it is a uh, cancerous process or if it's some infection, okay? So there's some things that you can look for. So if the lymph nodes are, let's see, if the lymph nodes are uh, tender, painful, tender, uh, inflamed, and uh, and mobile, right? Mobile means they're not fixed, so you can literally feel them. And sometimes they can grow to golf ball sizes, right? But if you can move them, and they're not like attached and tethered to the underlying tissue, uh, then more likely to be an infection. Okay, so that's kind of like a good sign in a way. It's at least it's not cancer, right? So if they're tender, painful, inflamed, and mobile, you can actually move them side to side. Uh, that's more likely to be an infection. But on the other hand, if the lymph nodes are non-tender, right, no pain there, and fixed, right, fixed, which means when you try to move them, they seem to be like tightly tethered or fixed to the underlying tissue, then that is more likely to be a cancer. All right. So this is simply something that you can kind of uh, figure out on physical exam of a patient who's presenting with lymphadenopathy, enlarged lymph nodes. Okay. All right. So, but what does the insides of the lymph node look like? Um, so what you have here is a capsule, right? This is a capsule surrounding the outside, and then the capsule also moves inwards, and then it's called a trabecula. These are all trabecula, the capsule dipping inwards, right? And then you have the cortex, which is the outer region, and then you have the medulla, which is the deeper region here. You also have these like triangular purplish pink areas, these are called the germinal centers. They hold your B lymphocytes and your macrophages. B lymphocytes and macrophages. Again, your immune cells are found here, okay? In addition to that, you see all of these smaller vessels, which are called the afferent lymphatic vessels, which are bringing in lymph to the lymph node. And there's only a single efferent lymphatic vessels with an E, which is taking out the lymph, all right? So multiple afferent lymphatic vessels, which bring in the lymph, and a single efferent lymphatic vessel, which takes out the lymph. So why do you have so many of them, multiple afferent ones and only a single efferent one? Because this builds up pressure. You have a whole lot of lymph pouring into the lymph node, but there's only one drainage here. So that ensures that there's only a one-way flow. Lymph only flows from the afferent into the efferent ones and not vice versa. It doesn't back up, right? It doesn't go back up here. So this is what the germinal center looks like on the inside. What you have in the germinal center, again, as I mentioned before, lots of B lymphocytes and macrophages, okay? This is what you have, these types of immune cells which are housed inside of the germinal centers. The medulla, which is the deeper part over here, the medulla of the lymph node contains what? It contains B lymphocytes, T lymphocytes, and also macrophages. So those are also contained here. All right, so let's take a look at a type of blood cancer, or should I say lymph cancer, called a lymphoma, okay? So lymphoma is a type of blood / lymph cancer where you are producing either abnormal or mutated T and B cells or no T and B cells, functional B and T cells, all right? So lymphoma is more common in people who are exposed to certain radiations, to certain chemicals, right? For example, the power lines, if you have a lot of those in the area, that could be a risk factor for lymphomas. Certain chemicals, if you work in the rubber industry or in the petroleum industry, you're exposed to those kinds of chemicals. Those are risk factors for lymphomas, right? Risk factors for lymphoma. And lymphoma, again, is a blood cancer affecting your T and B lymphocytes, all right? So here we are looking at some of the possible signs and symptoms like night sweats, fever, weight loss, aches and pains, splenomegaly, your spleen becomes enlarged too. These are some of the vague, non-specific signs and symptoms. So lymphomas are of two types, Hodgkin lymphoma and non-Hodgkin lymphomas. Hodgkin's lymphoma usually has a better prognosis, better result as compared to non-Hodgkin lymphomas, okay? And it's found either in young adults or people who are older than 60 years of age. If caught early, it has a pretty good treatment rate, okay? Non-Hodgkin lymphomas, some of them are slow growing, but mostly they're more aggressive than Hodgkin lymphomas. How do you differentiate whether it's a Hodgkin or a non-Hodgkin lymphoma? Well, you have to take a biopsy of the lymph node, right? So you have to cut out a piece of the lymph node, put it on a microscope slide, and take a look. And if what you see there are something called Reed-Sternberg cells, which are seen in Hodgkin lymphoma. So if you see Reed-Sternberg cells on a biopsy, then this is a Hodgkin lymphoma that you are dealing with. And the Reed-Sternberg cells, they kind of look like owl eye cells. And I'm going to make a picture here, right? They literally look like owl eyes staring back at you through the microscope, right? So those are Reed-Sternberg cells. So owl eyes appearance. Hodgkin lymphoma is what you likely have. All right. How do you treat lymphomas? Again, chemotherapy, radiotherapy, and surgery. Those are the three main modes of treatment. Okay. So then moving over to spleen, which is the largest lymphatic organ of the lymphatic system, right? The spleen is located where? In your left hypochondrium, left side of the abdomen, okay? And what you're looking at here is the splenic tissue, all right? This is your spleen under the microscope. So your spleen has what is called the white pulp All right, so all these lighter, like pinkish areas, and the red pulp. The red pulp is this bright red color. Okay, so the white pulp and the red pulp. These are the two types of tissue that make up your spleen. So what is the function of each? The red pulp actually is rich with, not surprisingly, with your red blood cells. All right, that's why it appears red. The white pulp actually carries your white blood cells. So therefore the colors go with the type of cells that you have there, all right? In addition to your red blood cells, the red pulp also carries some B lymphocytes, macrophages, and platelets as well, okay? Um, and white pulp is made up of white blood cells like T and B lymphocytes and macrophages, which are types of white immune cells. So the function of spleen is what? Again, like the rest of your lymphatic organs, the spleen keeps an eye out for infections and cancers. It removes foreign materials like bacteria and cancer cells from the bloodstream, okay? That's what it does. As you can see here, eats up foreign particles, something called phagocytosis, clears defective red blood cells, and it also stores red blood cells and platelets, all right? Also remember that when you were a fetus, in the first 5 months of your fetal development, it was actually your spleen that was making blood for you because you didn't even have bone marrow at that point. We didn't have bones. Bones form later during development. After the 6 months of development is when you start forming bones, hard bones. And that's when your red bone marrow takes over the function of making blood. Before that, spleen is what is making blood, all right? Splenectomy here, as you can see, is a surgical procedure where you cut out the spleen, you remove it surgically. And why might you have to cut out the spleen? Where the spleen gets enlarged, splenomegaly. What can cause your spleen to get enlarged? Again, lymphomas, leukemias, sickle cell anemia. All right. So any disorder of the blood in your spleen is vulnerable to enlargement, and it needs to be removed, as you can see here, all right? Certain cysts, like parasitic cysts, can form in the spleen as well, and that's when the spleen will need to be removed as in those situations too. Okay, so next up, okay, so the tonsils, again, are yet another type of lymphatic organs. Remember, again, lymphatic organs are those that actually have a well-defined capsule, connective tissue capsule surrounding them. Versus lymphatic nodules or lymphoid tissue, that those are clusters without a capsule of lymphoid uh, tissues scattered throughout the system. All right, so there's three types of tonsils that we are looking at here: the pharyngeal tonsil, the palatine, and the lingual tonsils. Now, of course, the name has to do with all right, so I apologize. Did not realize that the sound was not working. I just did. Right, so talking about the tonsils, um, we have these three here, the pharyngeal, the palatine, and the lingual tonsils, and each one is basically indicating where it's found, right? So the pharyngeal tonsils, of course, right here in the pharyngeal region, and the pharynx, again, is the back of the throat, as you can see. Uh, this area is also called adenoids when it's enlarged, and this is one of the most frequently infected areas, something called tonsillitis, right? Inflammation of the tonsils. Palatine tonsils, right here at the very back of the palate, and then of course the lingual tonsils under the tongue, right at the back of the tongue, right here, okay? So you have these three types, which are uh, actual lymphatic organs. And remember, again, organs are those lymphatic tissue that have a well-defined capsule around them versus nodules or lymphatic aggregates, okay? All right, so what tonsils do, like pretty much all other lymphatic organs, is immune surveillance, which means they keep an eye out for infections and cancers. And earlier we talked about how can we differentiate on clinical exam a likely infectious pathology versus a cancerous or malignant pathology, okay? So here are tonsils under the microscope, and one thing you would appreciate at this point is almost all of these lymphatic structures, they look very similar under the microscope. They all have this outer cortex and the lighter colored medulla deeper to the cortex. They all have germinal centers, so very similar arrangement, okay? So it's kind of like a good thing. If you see a picture like this, it tells you right away that you're dealing with a lymphatic organ, okay? So acute tonsillitis, as we were mentioning before, is an inflammation of the tonsils. And again, various infections would lead to it, quite frequent in children, especially the pharyngeal tonsils, as we mentioned before, okay? And so what happens here is, of course, a pathogen, a bacteria or a virus is trapped by the lymph node, and the white blood cells which are found therein, your T and B lymphocytes, react to this pathogen, causing inflammation, okay? And that results in reddening and enlargement. These are the hallmarks of inflammation, okay? It can lead to difficulty swallowing, difficulty breathing, and especially in small children, if there's like repeated tonsillitis, not only is it painful for them, but that can actually be a risk factor for respiratory distress. They cannot breathe properly, right? And so then at that point, it's called chronic tonsillitis. So how do you treat tonsillitis, acute or chronic, is first with antibiotics. You try to eliminate the infection, but then sometimes surgery is needed, especially if this is a chronic condition, it's ongoing, and so the child is needlessly suffering because of high fevers and lack of swallowing or breathing properly, okay? So removing the tonsils is often the best course of action there. Now remember, we have three sets. We have the pharyngeal, palatine, and then the lingual tonsils. So if one set is taken out, then the others would basically perform that immune surveillance job here. Okay, next up we have lymphatic nodules, and they do not have a protective capsule around them. They're scattered throughout different organs, as you can see. For example, MALT, which stands for mucosa-associated lymphoid tissue or lymphatic tissue, and this is found in your small intestine with in great numbers, as well as your respiratory, genital, genitourinary tracts. So you might be wondering why these areas, okay? And the obvious answer is these are all the places where you are transacting with the environment around you, right? GI tract, things that you eat, respiratory tract, things that you breathe, genitourinary tract, again, you're coming in, you're excreting, and your reproductive fluids are basically in contact with the outside world. So those are the places where you will have MALT or mucosa-associated lymphoid tissue, okay? Um, Especially in the small intestine, as I was saying, in the region called the ileum. And in that part, they are called Peyer's patches, as you can see here, okay? So these lymphatic nodules are called Peyer's patches in the small intestine. How does lymph flow through a lymph node? It comes in through the afferent lymphatic ducts with an A, afferent, and it leaves via a single efferent duct with an E. And how is it monitored by macrophages and lymphocytes? They're found throughout the germinal centers, and they keep an eye out for infections and cancer cells. What are the general functions of the spleen? Remember the red pulp and the white pulp. Red pulp is used for red blood cell storage and recycling, and the white pulp stores immune cells for immune functioning. Okay, which lymphatic structures filter lymph? Tonsils uh, and tonsils and your lymphatic nodules, like your MALT, right? Which filters blood? Spleen. What are the three main groups of tonsils? Pharyngeal, palatine, and lingual. And their function? Immune surveillance again. What is the function of MALT in the mucosal linings of the GI, respiratory, urinary, and reproductive tracts? Again, immune surveillance, keeping an eye out for any potential trouble in terms of germs, infections, or actual cancer cells. All right, so that was all for the lymphatic system. And so we'll go ahead and start on chapter 22 here, which is uh, the immune system, also one of my all-time favorites, right next to the central nervous system, right? Those two would be what I basically have a lot of interest in. So let me quickly write it down here. All right. And so you might be wondering why that is the case, right? Why are these two organ systems my favorite? And the answer is uh, these two systems are the ones that are completely unique in each individual, okay? So even though no two people have, of course, exactly the same GI tracts or reproductive systems or any of those, but for the most part, by and large, it's the same. Uh, Same functions and same etiology, uh, same physiology of these organs. But if you look at the central nervous system and the immune systems, no two people have the exact same brain. The brain development is quite different, right? And what uh, the cognitive functions of the brain are for each person are as unique as that person's fingerprints, as is their immune system, right? For example, if I have access to a blood sample from you, now based on your profile of antibodies and white blood cells, I can tell you exactly where you were likely born, where did you spend your childhood and your teenage years, and where you are at right now, okay? So your blood carries your entire immune profile within itself. And no two people have exactly the same immune profile, right? So part of your immune system is genetically determined, but then your immune system also develops according to what kinds of pathogens you were exposed to, right? So for example, if you have antibodies against, let's say, hookworms or something, right? Now I can safely predict that you likely grew up in a tropical area where those worms are um, quite abundant, right, and quite common. So take some more notes. Hookworms and immune system. And by the way, hookworms are these parasites that basically have hook-like mouth parts. They attach to your small intestine, and they siphon off nutrition and blood from you. Sounds terrible, right? And they might cause some vague signs and symptoms like anemia and sometimes abdominal pain, cramps, indigestion, those kinds of things. But studies have shown that infection with hookworms also prevents or protects you from developing allergies and asthma. So there you have it, right? Some of the proteins that are secreted by the hookworms actually prime your immune system in a way where you don't get these allergic symptoms that much. So uh, there's always a silver lining to the cloud, okay? All right, so when you talk about the immune system, it fights off infectious agents and also called pathogens or germs. And so there are five major categories that we will focus on here: bacteria, viruses, fungi, protozoa, and multicellular parasites, okay? So let's start with bacteria first. So these are the very first cells on planet Earth, okay? These are prokaryotic cells, and what we mean by prokaryotic means they do not have a nucleus. They do not have a well-defined nucleus. They do have um, genetic material in the form of RNA and DNA, but that is not contained within a well-defined differentiated nucleus, okay? So something to remember. Now, these are single-celled organisms. They were the very first cells on planet Earth, as I mentioned before. They come in different shapes. For example, there is a spherical bacteria, rounded, called cocci. There are rod-like ones called bacilli, and there are even some comma-shaped or coiled called spirilla, okay? And most of these bacteria are either harmless or some are beneficial actually to us, right? So there's, for example, bacteria in our intestines that manufacture vitamins B and K, all right? And that's why taking broad spectrum antibiotics for an infection like a sore throat or something, which is most likely viral, is not such a good idea because these antibiotics not only wipe out the pathogenic bacteria, but they also get rid of the beneficial vitamin B and vitamin K forming bacteria. And that's why A common side effect or after effect of being on an antibiotic course is diarrhea. The diarrhea is actually indicating that your bacterial balance, your gut microbiome has been altered somewhat, okay? So the ones that do cause diseases, they're called virulent, as you can see. And some of these bacteria have different structures like pili. These are like hair-like projections that allows them to latch onto different cells. They might release toxins that can make you sick. Okay, here are some examples of those virulent bacteria like Clostridium tetani that cause tetanus, and then the strep bacteria that give you the strep throat. The ones that you're looking at here in this picture are bacilli. You see they're rod-shaped, elongated bacteria. So bacilli is what they are. Okay, then come in the viruses, and viruses are one of the most fascinating biological entities of all because we don't really understand them that well, and we don't really know if they're living or non-living. So they're in the perfect twilight zone in between living and non-living organisms. Why? Because first up, they're not made up of cells. Viruses are not cells. They're much smaller. They do not have a cell wall. They do not have any organelles, cell organelles that you would see. They are just a bunch of genetic material, either DNA or RNA. Now remember, no virus has both RNA and DNA within the same structure. So there are either RNA viruses or DNA viruses, okay? And all you have is that genetic material surrounded by a protein coat. And that's it. It's a very simple biological piece of biological machinery, okay? Not technically living. They don't have organelles, they don't have a metabolism, they don't eat, breathe, none of that. However, these are parasitic life for, well, I wouldn't say life because we don't know if they're living or non-living. These are parasitic entities because in order for them to successfully reproduce, they need to hijack and infect a living cell, and they inject their own genetic material into the living cell to make copies of themselves, okay? So they're obligate intracellular parasites, as you can see here. And so there's a host of them, DNA versus RNA viruses, okay? For example, COVID-19, the coronavirus, SARS-CoV-2, is an RNA virus, as is flu. Influenza is an RNA virus. Ebola, RNA. HIV, these are all RNA viruses too, versus hepatitis B or chickenpox causing virus, varicella virus, herpes viruses. Uh, these are all DNA viruses. Smallpox, these pox viruses in general are DNA viruses. So DNA versus RNA viruses. So here you can see, and these look like influenza viruses, right? They're spherical, and the protein coat has these kind of spikes, spiky conditions, spiky projections that enable them to latch on to living cells. Even if you look at the coronavirus, SARS-CoV-2, the word corona itself means like a halo, like a crown. And it seems like the virus is wearing a crown, like a crown of spikes um, around itself, and those crowns, those spikes, allow the virus to latch onto your cells, to attach their inject their genetic material, which is RNA, into your cells. And then you have fungi, and fungi are a separate kingdom in their own right. They're neither plants nor animals nor bacteria. Fungi are eukaryotic cells, eukaryotic organisms, which means they do have a nucleus. They also have a cell wall that protects them from attack by outside agents, and they can release proteolytic enzymes, enzymes that break down protein, that drill holes into your cells, thereby causing inflammation, okay? And some examples of fungal infections, athlete's foot, right? Yeast infections, both of the mouth and the vagina. Some lung infections like histoplasmosis. These are all caused by fungi. Then you have protozoans or protozoa, which are unicellular eukaryotic. Um, Not all of them are unicellular, but mostly unicellular eukaryotic cells, which means they do have a nucleus, okay? And there's a bunch of them. And some of the more troublesome ones, the ones that cause diseases such as malaria and trichomoniasis, right, which is an STD, the tricks, the so-called infection there. So now, speaking of these protozoa, the ones that cause malaria are called Plasmodium falciparum, okay? And then the one that causes trichomoniasis, which is an STD, is called Trichomonas vaginalis. All right, and then finally, we have multicellular larger parasites like these worms. We talked about hookworms. There's also roundworms, tapeworms. They all belong to these multicellular parasitic types. All right. Okay, then you also have entities like prions. And what are prions? Interesting. These are neither viruses nor bacteria nor any of the others. They are just a bunch of infectious protein. That's all there is. There is no genetic material inside of them either. No DNA, no RNA, none of that. Uh, so these are misshapen, messed up proteins, if you will, that have the ability to infect living cells and um, completely shut down their metabolic machinery, okay? They seem to have a high propensity for brain tissue. So for example, if you talk about the mad cow disease, which is found in cattle, cows, of course, uh, that is caused by a prion. This mad cow disease causing prion can also jump into humans if you consume uh, poorly or uncooked beef, then it can infect the human brain tissue as well. The human variant of mad cow disease is called CJD for Creutzfeldt-Jakob disease, as you see here, right? The mad cow disease itself is called uh, BSE for bovine spongiform encephalopathy. And the name itself pretty much tells you what happens if you contract mad cow disease or its human variant called the Creutzfeldt-Jakob disease, okay? Bovine, it means it's in cows, in cattle. Spongiform, it turns your brain into spongy, mush-like tissue. Encephalopathy, again, brain infection, okay? And there were uh, some pretty grisly accounts in human history where there were some cannibalistic tribes, people that were eating other humans, right? Such as on the island, some of the New Guinea islands, right? So whenever they will vanquish their neighboring tribe or something like that, one of the things that they did culturally was to consume the brains of their victims, okay? Uncooked brains. And so what was seen in many of these people was uh, what is called kuru, 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 also known as laughing death. So what happened in these people who had consumed these uncooked brains was uh, it seemed like they were like laughing uncontrollably, right? And this was the terminal stage of the disease, but they were not laughing because they found anything humorous. This laughing reflex was because their jaw muscles and the cheek muscles were in permanent spasm and contraction. It seemed like they were grinning, but this was an indication of terminal destruction of the brain tissue, and they would die shortly afterwards, and therefore the name, laughing death for Kuru. Which pathogen must enter a cell to replicate? Viruses, right? They cannot reproduce by themselves. Which type of pathogen is composed of prokaryotic cells? Bacteria. They do not have a nucleus. All right, so let's start with white blood cells, which are immune cells, of course, also called leukocytes, leuko for white, cytes for cells. They're divided into two categories, granulocytes, which means granule or sediment containing cells, because when you look at these cells under the microscope, it seems like the cytoplasm has these granules, sandy stuff inside of them. Like neutrophils, eosinophils, and basophils, right? And also monocytes, these cells turn into macrophages, large cell-eating cells, like Pac-Man cells, if you will. And then lymphocytes, like T and B lymphocytes, and also what are called natural killer cells, okay? All right, so the granulocytes are the first three, and then you have the agranulocytes, which are the lymphocytes and the monocytes. Okay, we already talked about primary versus secondary lymphatic structures, right? So you're looking at those examples here again. So where are these immune cells found? They are found anywhere where your body is likely to come in contact with the outside environment for your protection, right? For example, they're found in the epithelial layers of your skin and your mucous membrane in the nose, mouth, in the reproductive regions, genital regions, throughout the skin, all right? And so these are called dendritic cells. And the dendritic cells, they engulf or eat up pathogens that might be capable of causing disease. Then your connective tissue houses mast cells. And what these mast cells do is whenever they come in contact with pathogens, they release a lot of histamine and heparin. So histamine causes itching, rash. Heparin causes the blood flow to increase to that area. So what you would experience in an allergic reaction, right? So that is what your mast cells basically do. So here in this picture, you can look at the location of different types of immune cells, right? So these ones are found uh, so these are your secondary lymphatic structures, lymph node, spleen, etc., etc. Here you have macrophages in your lungs called the pulmonary alveolar macrophages. They clean up your lungs. Dendritic cells under the skin and connective tissue, and mast cells also in the connective tissue that release histamine and heparin. So, and here you have the different types of white blood cells. These three, neutrophils, eosinophils and basophils, are called granulocytes. Monocytes and lymphocytes, those two are agranulocytes. So cytokines, what are those? These are proteins that are released by your white blood cells, okay? Your immune system releases these proteins called cytokines. And what they do is they recognize and destroy the disease-causing germ, okay? So they cause inflammation and they basically try to wipe out the infection. So sometimes too much of a good thing can be a bad thing, right? So here what I'm referring to is something called the cytokine storm, okay? A cytokine storm. And so what a cytokine storm is, and by the way, a lot of people that lost their lives to COVID-19 actually did not die because of the virus itself, but because of their own immune system that had gone into overdrive, right? Um, In other words, they developed a cytokine storm. So in some people, once they are infected with a certain virus or a bacterium, their immune system reacts violently against it and releases a whole bunch of cytokines, all right, which is something called a cytokine storm. And so many cytokines that in fact it can destroy their own organs. So their blood vessels start breaking down, they start developing blood clots and uncontrolled bleeding at the same time, right? um, Bleeding disorders, their lungs fill up with fluid, all these things, the kidneys go into failure, and all those kinds of things happen. So a cytokine storm might account for a lot of these deaths. As I was mentioning, everyone's immune system is a little different, okay? So the best thing that we can do to keep our immune systems in the best shape possible, again, is to focus on our diet and our exercise, okay? Eating a healthy Mediterranean diet, getting regular exercise, outdoors exercise, getting enough amounts of sleep, all of these things basically maintain your immune system uh, in in good shape, all right? And that's what you need to fight off all of these infections, of course. So our immunity is of two types, the innate immunity versus adaptive immunity. The difference is innate immunity is something that most people are born with, like most people have a skin when they're born, which is a barrier to the pathogens. We all have mucus in our noses and our mouth, right? That's a type of innate immunity. We all have neutrophils, basophils, and eosinophils, those kinds of white blood cells that fight off infections that might try to invade our skin, a cut in our skin or something. That's innate immunity, okay? Saliva, that fights germs, that's innate immunity. Adaptive immunity is what we develop as we grow up and we come in contact with more specific and unique types of germs, right? And that's why we get shots, influenza shots or COVID-19 shots. That's what we're trying to do. When you get a shot, what they're doing is they're putting in a dead or weak virus of that variety into your bloodstream, right? And why? So that your immune cells can react to that virus and make the appropriate antibodies so that the next time the real virus comes around, you already have preformed antibodies to knock out that virus out of the system, right? That's adaptive immunity. Another way of getting adaptive immunity is if you fall sick with that germ and then your body slowly recovers and forms antibodies, that's called active immunity as well. So getting vaccinations or getting sick with the disease and then recovering both give you active immunity against that bacterium or that virus. Okay. So here, this is a good chart which basically uh, tells you everything about the organization of the immune system, right? So innate immune system is or natural immunity. We are born with it. Skin and mucous membranes. Uh, Macrophages, natural killer cells, right? Cytokines, interferons, all of those um, inflammatory substances, inflammation, and fever. Adaptive immune system is something that you do. Now, this is completely unique to each individual because the diseases that I have might have come in contact with would be different from what you came in contact with, depending on where we lived, how we lived, what our circumstances were. All right, and that story is transcribed into our immune cells, basically. So when you talk about the adaptive, also called the specific immune system, um, it's basically made up of these two cell types, the T lymphocytes and the B lymphocytes. They together make up your adaptive immune system. Okay. So identify these specific type of immune cells within each of these structures: connective tissue, mast cells, skin, dendritic cells, organs, neutrophils, basophils, or eosinophils. Secondary lymphatic organs, again, the B lymphocytes and the T lymphocytes and the macrophages. What is the definition of a cytokine? It's a protein released by your immune cells to fight infections. How are cytokines similar to hormones? They affect your cells to make certain products that would change their functioning, right? So hormones make your cells either increase or decrease their metabolism or to reproduce. Cytokines cause your cells to make disease fighting chemicals. What are the cells that provide adaptive immunity? The T and the B lymphocytes. All right, so let's start with your innate immunity first, which is our, what should I say, immunity that we are born with, right? It's non-specific or non-adaptive immunity as well. So the first line of defense that we have here is our skin and mucous membranes, of course, right? The second line of defense are the stuff that is right under our skin, for example, neutrophils, macrophages, basophils, eosinophils, all of those white blood cells. Also chemicals like cytokines, complement and interferon, and inflammation and fever. They're all parts of your innate immune systems, okay? So first up, our skin is a wonderful barrier against germs. That's why whenever you get a cut on your skin, ideally you should put on some antibiotic cream there, because you don't want any external pathogens being introduced there. Uh, so the skin itself releases many uh, antimicrobial substances like dermicidin, lysozyme, sebum, defensins, all of them, all right? And so that's why one thing that I'm very careful about is not to touch my nose if there's an itch or something like that with the palms of my hand, because as we shall, or you must have studied during ENP1, there are no sebaceous glands on the thick skin of your palms and your soles. And sebum, which is secreted by your skin oils secreted by the sebaceous glands, have many disease-fighting, bacteria-fighting chemicals in them. They're absent in your palms and your soles, but the rest of your skin has it. So therefore, if I really have to itch my nose or something, I use the back of my arm rather than my palm to do that, all right? Because there's sebum there, which is rich with disease-fighting chemicals, as is. Lysozyme, that's where Lysol comes from, right? Makes sense. So lysozyme is an enzyme that literally breaks the bacterial cell walls apart and kills them. Defensins fights many types of bacteria and viruses as well, okay? The skin has its normal own, very own uh, growth of microorganisms or bacteria which are healthy, and they prevent the unhealthy type or the pathogenic type from taking over, okay? So that's why if you shower too much, even taking a bath too often, like twice a day, every day, That's not recommended either, because then you're going to dry out your skin. You're going to scrub off all of this helpful, healthy sebum, and change the composition of the healthy bacteria that you have on your skin. So twice a week, uh, 3 times a week. That's a good number there. All right. Then also the mucous membranes, like in your nose and your mouth, they produce mucus, right? And mucus again has many disease-fighting chemicals like defensins, lysozyme, IgA, which is actually an antibody which which fights many different types of viruses. And the mucous membranes are also lined by bacteria that are actually helpful. They prevent the pathogenic bacteria from growing there, okay? Then once you get past the skin, you have these phagocytic cells, cells that eat up pathogens or germs, like Pac-Man cells of the body, like neutrophils, macrophages, and dendritic cells, all right? They literally engulf or eat up, like Pac-Man cells of the body, any of the pathogens. And then they destroy those pathogens with free oxygen radicals, the toxic molecules that kill the pathogens, okay? So here in this picture, you can see, uh, no, looks like yeah, that is a macrophage, a large cell-eating cell, right? And so what this macrophage is doing is it is engulfing this infectious particle, looks like a bacterium. Once it's engulfed, then it's destroying it with free oxygen radicals, and all that you have left here is broken down, harmless debris, which is exocytosed, which is thrown out. Same with the dendritic cell. The dendritic cell does the very same thing. All right, so these are some cells which promote inflammation, basophils and mast cells. So when the next time that you have a major allergic reaction, right, uh, sneezing and rash and eyes watering and all of that, you have these cells to thank for it or curse for it, whatever. Basophils and mast cells, all right? Because what they secrete, mast cells, is histamine and heparin. Histamine causes itching and vasodilation. So it makes the inflamed area hot to the touch and swollen and red. And then heparin increases blood supply to the area, because what uh, these cells are trying to do is they're trying to wash off any pathogen that might be stuck in that region. So that's what's happening here. So here you can see what your mast cells and your basophils do. They secrete histamine and heparin, which increases inflammation. Your capillaries dilate, a lot of fluid starts leaking out, so swelling happens here, and that should clean up any uh, disease-causing germs that might be stuck in this area. So then you have natural killer cells, and they do exactly what the name suggests. They kill unhealthy, unwanted cells, as you can see here, like cells infected with some pathogen, cancer cells, right? Natural killer cells are an effective way of getting rid of them. And how they kill these problematic cells is by releasing two chemicals, perforins and granzymes, okay? So how do those work? Perforin is a protein that perforates or punches holes in the cell walls of bacteria, so killing them. Granzyme is an enzyme that causes disease-causing bacteria to shrivel up and undergo cell death, something called apoptosis. So 2 ways that natural killer cells destroy uh, bacteria, okay? Eosinophils, these are like reddish um, white blood cells. They have reddish granules inside of them, and they tend to rise when you have worms. All right, worm infestation causes an increase in eosinophils. It might be your pet as well. If you have your dog or cat uh, is taken for a blood sample, and when they find that there's eosinophilia, high levels of eosinophils in the blood, that indicates some kind of a parasitic worm infestation in them as well. Okay, so there's a parasitic worm, looks like like a round worm. And here are your eosinophils. You can see the red granules. Eosin means red. It's a red dye, which colors these reddish granules. And so it releases cytotoxic chemicals to destroy, to fight off the parasitic worm. So now you're looking at a bunch of antimicrobial proteins that your immune system produces, like interferons. Interferons are a class of cytokines, and they are pretty effective in fighting off viruses, such as the hepatitis C virus. So hepatitis C, again, is it's an infectious illness, all right? And hepatitis C It infects your liver cells, and in about 20% of people, it can result in a chronic infection. It likes to hide out in your liver and infect it for long periods of time. Have chronic infection, and some of those people go on to develop liver cancer. Okay, it can cause liver cancer or liver failure. In fact, when I was working as a medical resident in the medical ICU, I saw a pretty high number of these patients with hepatitis B and C, okay, who were in hepatic failure, liver failure, the end stages. How does hepatitis C spread? It spreads by means of pretty much like AIDS, like HIV. It spreads by unscreened blood transfusions, right? If you're transfused blood that is not properly screened from mother to child, which is called vertical transmission, mother to child. It can be spread by sharing needles or sharp instruments, right, which are blood contaminated, sharing needles, and rarely by sexual activity as well. Okay, and so interferons are used to fight viruses like hepatitis C. Now we have a very effective treatment against hepatitis C. Previously, there is no vaccine for it, but we can give them the alpha interferons, these ones, to destroy uh, and to keep in check the hepatitis C viruses. So what they do is interferon alpha and interferon beta, they basically prevent infection. They trigger synthesis of enzymes, and these enzymes destroy the viruses uh, and they inhibit the viruses from reproducing. Okay, they cut down the viral load. Then you have another type, the interferon gamma, which is produced by your T lymphocytes and the natural killer cells, and the interferon gamma actually stimulates your macrophages to eat up the virus infected cells, and you can see that here in this picture. Uh, the interferon alpha and beta, they are causing the infected cell uh, to either destroy, or they are slowing down the replication of the virus themselves. They are interfering with the viral replication. Interferon gamma, on the other hand, which is secreted by natural killer cells, right, is causing the activation of these macrophages, which will engulf and destroy the infected cell, as you can see here. So in addition to interferons, you also have proteins, a group of 30 plasma proteins called complements, the complement system, okay? And these are made in your liver. And the complement system, again, is basically a pretty effective way of fighting off infections. So to activate your complement system, there's a number of pathways. There's a classical pathway and there's an alternative pathway, okay? So how does the classical pathway get activated? For classical pathway to be activated, you need the antibody to attach to the germ itself physically and then bind the complement to the antibody. In the alternative pathway, the complement, which is the protein produced by the liver, binds to the bacterial or fungal cell wall instead of the antibody, right? So for the classical pathway, an antibody is involved. For alternative pathway, the complement binds directly to the fungal or the bacterial cell wall. So once we have that happen, how does the complement system destroy the offending agent? So here are some ways that it can do it. The first one is called opsonization. What is opsonization? Here is your disease-causing germ, a bacterium, right? Here is your complement. This is the protein produced by your liver. The complement attaches to the germ, the pathogen, and then it marks it for destruction. That's what it is. It marks it for destruction so the macrophage can come in, this Pac-Man cell, and eat up the whole thing. That's opsonization. Another way of doing the same thing by the complement system is to increase inflammation, right? When you increase inflammation, that attracts all of these white blood cells to the area and they will destroy the pathogen causing the infection. Complements also can cause cytolysis, which literally means breaking open the cell, right? So here you have the complement attaching to the pathogen and literally dissolving it up. You see it's dissolved here, right? This is cytolysis. And finally, the elimination of immune complexes. How that happens is, here's the complement. It attaches uh, to an antibody on the one hand, and the antibody has the germ attached to it here, and then it attaches to a red blood cell on the other hand. So this germ is trapped in this complex, and this complex will go to your spleen, because remember, the spleen is where your red blood cells are recycled, and once it gets to the spleen, that this will be neutralized. The germ here will be destroyed, and this is elimination of immune complexes. So 4 ways that your complement can fight infections. Okay, so then what is inflammation? When we talked about that, 4 things: swelling, pain or itching, redness, and warmth. If you have those 4 things going on, you have inflammation in a body region. Okay, and what causes inflammation is a number of things like histamine, leukotrienes, different types of prostaglandins, a number of inflammation causing chemicals. Okay, all right, so your white blood cells, how do they get to the point of action? How do they know where the infection is going on and where are they needed? So they show a number of characteristics which are here, like diapedesis and chemotaxis. So what does that mean? Diapedesis, your white blood cells are able to squeeze through these tiny cracks in your blood vessels, okay? But how do they know that they're even needed? What gives them a distress call, like a distress signal? That is something called chemotaxis, which literally means chemicals secreted by your injured or infected tissues that are picked up by your white blood cells so that they can squeeze through your red blood, your blood capillaries, blood vessels, and then swim with the blood flow to the area of infection. All right, so diapedesis and chemotaxis, 2 words to remember here. So what happens in inflammation? All of these things start building up at the site of infection. Immunoglobulins, these are your antibodies, all right? Immunoglobulins are antibodies. Complement, clotting proteins, and kinins. All of them get to the area of action. So the clotting proteins form a blood clot wherever there's an infection, okay? And then the kinins, they cause pain in that area, so you're aware of the inflammation going on. So with ongoing inflammation, you eventually form pus in that area. Which is an exudate, right? Pus is an exudate. And what pus contains is all of these white blood cells, the germs, the pathogens that were in that area. And basically, if the pus keeps building up and is unable to be cleared off, then that's what forms an abscess, right? An abscess is uh, pus that has been contained to an area. So pus-filled, pus, uh, vesicles, right? That is something called an abscess. And there's different types of abscesses. For example, something called a breast abscess that can happen in someone who has a newborn baby, and the lady in question is trying to feed the child. The child is like kind of moving his head about or is too vigorous, sucking on the nipple, and that can sometimes lead to a breast abscess, which could be quite painful and can interfere with the suckling feeding process, right? So it's nothing but pus trapped in that area because of chronic inflammation or breast abscess. How you take care of it, again, is warm compresses there, antibiotics, and sometimes, rarely, surgery is needed as well to drain the pus from that area, okay? So it takes about 72 hours for the inflammation to slow down, and at that time, the pus is cleaned out by the phagocytic bacteria, the phagocytic cells like the macrophages and the neutrophils, okay, and the tissue repair begins at that point. In chronic inflammation, that repair process could go on for a much longer time, and that's when you develop scars. So scarring is something that you get with chronic inflammation, okay? So these are all of the events that happen during inflammation. So you see there's a cut through the skin and a bunch of bacteria that have invaded the skin here, right? So your mast cells are releasing histamine and heparin like crazy, and then what happens is a lot of blood is flowing to this area. So your white blood cells get the signal of infection. So now they're squeezing out of your blood vessels by means of diapedesis, and they're being attracted to the area of infection, something called chemotaxis. And so now the pus formation has started here, formation of exudate, which is pus. Okay, so these are the events of inflammation. There again, the four cardinal signs of inflammation, as you can see. And with chronic inflammation, that can cause detrimental effects, all right? Now, chronic inflammation could be a number of things. For one, if you have a lot of body fat, especially belly fat, that in itself is a chronic inflammatory tissue. Remember that, right? So if you have poor eating habits, lots of fatty, greasy, fried foods, and you have a lot of belly fat, not enough exercise, and all of those things, then you have chronic inflammation going on as is in your system. And this chronic inflammation is going to damage everything from your blood vessels to heart, to your brain, to your kidneys, number of diseases to your joints. Chronic inflammation is a major issue with obesity or belly fat, right? So obesity slash visceral fat equals chronic inflammation. Okay, and chronic inflammation would lead to cardiovascular system damage, right? Arthritis, even cancers, and kidney damage, and brain damage. So all of that arising out of having too much body fat, simply the visceral fat. Okay, so fever, that is also a protective mechanism against infections. What is fever? When your body temperature, which is normally around 98.6 degrees Fahrenheit, is elevated to 1 degree Celsius or more. And what causes fever are chemicals called pyrogens, which are released from your immune cells, okay? For example, something called interleukin 1. Interleukin 1 is a pyrogen released by your immune cells. So what happens is these pyrogens, which are secreted in response to any infectious agents that have invaded your system, they go up to the base of your brain to an area called the hypothalamus. And the hypothalamus is the thermostat of the brain, thermostat of the body, actually. So then the hypothalamus releases a chemical called prostaglandin E2. And so that raises your body temperature set point at a higher level. So then you develop a fever. The fever has three steps of development. First is the onset of fever, and that's when the temperature begins to rise, okay? Why does the temperature rise? Because your blood vessels in your skin constrict. So the blood is diverted away to your brain and your critical organs. On top of that, you start shivering, you start getting chills. That also increases the body temperature. After the onset, there's something called a stadium when this high temperature is maintained, okay? And with high body temperature, your metabolism is fast, which means you start losing weight, you start breaking down body tissue, okay? And this high temperature also slows down the spread of the infection in your system. And then finally, you have defervescence, which means the temperature returns to normal. That happens when you are recovering from that infection, right? So the hypothalamus is no longer acted on by the pyrogens and you resume your normal temperature again. So fever is not without its own benefits. Fever is not, it's your body's response to infection. So as you can see here, low grade fever should not be treated. You should leave it untreated uh, unless it is high grade fever, of course, or unless you're talking about very young children, because their brains are very sensitive to temperature extremes. So there you might try things like cold sponges and stuff to bring the temperature down. But a light fever itself will do all of these things: prevent infection from spreading, increase your metabolism, promote your interferon, immune functions, and all those things happen, okay? But again, high fever, quite damaging, okay? And death is quite likely if your temperature is 109 degrees Fahrenheit and higher. So you have to do whatever you can to reduce the temperature at that point. And what makes fever so fatal is it causes your enzymes to denature, okay? You remember your enzymes are proteins, and they denature at high temperatures, your body metabolism stops. We already talked about pus. What pus is, it's a bunch of dead white blood cells and destroyed pathogens and cellular debris. If not cleaned out, then they can form an abscess. And an abscess might need to be surgically removed. That's trapped pus in an area. Okay. So some of the things that you can do for uh, dealing with acute inflammation is like application of ice, right? Ice causes your blood vessels to constrict, so the blood moves away from the infected area, and it also makes it less painful. It has a numbing action. So chronic inflammation, this is long-standing inflammation. Again, um, it can occur from overuse injuries like a tennis elbow, right? If you constantly engage in this motion, or even carpal tunnel syndrome, pain in your wrist. It could be due to an autoimmune disorder as well, where your own immunity is attacking your own body systems, like lupus, right, or SLE, those kinds of things. So chronic inflammation, again, will lead to tissue destruction and scar tissue formation, something which needs to be addressed. A lot of times it's simply because of lack of exercise and poor diet, as we mentioned before. So what is the role of the skin and mucous membranes in the body's defenses? They keep the pathogens away, and skin and mucous membranes also release a number of pathogenic chemicals like sebum, dermicidin, lysozymes, IgA, and so on. What distinguishes neutrophils from dendritic cells? Neutrophils are free-flowing cells, white blood cells in your blood. Dendritic cells are attached or resident cells under your skin. How do basophils differ from mast cells? Again, basophils travel throughout your bloodstream, while mast cells are attached to your connective tissue. How do natural killer cells accomplish the task of eliminating unwanted cells? They might use granzymes for apoptosis or perforins for punching out holes in the cell walls of bacteria. How is the complement system defined? A system of 30 proteins produced by your liver. What are the four major means by which complement participates in providing innate immunity? They might cause opsonization, cytolysis, um, immune complex destruction, right? And opsonization. What is inflammation? Redness, pain, or itch, warmth, and swelling. What are the basic steps involved in the inflammatory response? We took a look at that. In what ways does exudate assist in the body's defense? So that's pus. Pus basically traps the infection in a localized area. It does not let the infection spread to other parts of the body. All right, so we are going to stop here. Next up, we have adaptive immunity, or your specific immunity. So we shall discover what that is all about next time. So for tonight, again, you have your lab exam, 8 to 9:30 p.m. Don't forget to take that. You have your work cut out for your labs for next week as well. And I will be sending out the recording along with the notes for today. So please make sure you take some time over the week to go over that. Any questions, concerns, feedback, suggestions that you might have, please do not hesitate to let me know. All right, so please take care, stay safe, healthy, and happy, and I'll see you all uh, next week with a continuation of the chapter here. Bye-bye.